away behind one of South Africa's most scenic drives, the Garden Route's N2 in George, is Thembalethu Township. A place where its residents, even though they have to make do with very little in terms of sporting facilities, brim with hope of a brighter future. Thembalethu means our hope in the Nguni languages, and it's no wonder that the predominantly Xhosa population that resides there are hopeful of a better future where their kids will grow up to one day become sports stars like Sia Kolisi, for whom many of the kids at the school playgrounds believe they are, even when playing soccer. A fun sporting day at Gyalora Primary School, filled with endless play and song and dance, culminated with the Let's Play handing over a bag brimming with sporting equipment, which included netball, volleyball, soccer and rugby balls, along with a soccer kit. Access to sporting facilities is not the only need the residents of Thembalethu continue to grapple with on a daily basis. Access to basic health is also a major need for the community. Gyalora Primary School is one of 5 stops that a new mobile clinic created by Let's Play partner Bestmed Medical Scheme in partnership with the Unjani Clinic group. These mobile clinics will bring much needed primary healthcare to the community and around George, as well as parts of the Garden Route. Bestmed has invested in an Unjani Clinic health pod, which is a mobile clinic that is equipped with the necessary medical equipment to assist community members with their healthcare needs.
So in 2020, when COVID hit the country and basically the world, there were so many families that were under severe financial pressure, and even more families in rural areas. So at the time, Bestmed took hands with Unjani Clinics, and we distributed sanitary pad kits and cloth masks to communities that really struggled. And then the relationship grew from there. So we embarked on quite a few projects. And then in 2022, the 2 main projects were firstly, again, distributing reusable sanitary pad kits to schoolgirls. And the second project was an exciting project. It was an investment in an Unjani health pod. So these health pods are basically mobile clinics. They are equipped with medicine and with equipment, and they can basically then go into rural communities, and those members of the community that don't necessarily have access to primary health care and good quality medicine can now have access to these services via the health pods. So in this specific instance, our investment was in a health pod for the George and surrounding area, especially then the rural community. And we really do hope via this donation, more people that really deserve to be looked after in terms of their health will now have access to these services. So Unjani has a very interesting business model. So they do have healthcare clinics, but these are more like a stagnant clinic. But in some areas, this literally does not work. So the health pods are literally a clinic on wheels. So the nurses, they are called nursepreneurs. They actually tow this health pod with a relatively big vehicle into the area, and then members of the community will know when the health pod is available. And then, as it's a very good structure, it is as if a person is going into a building, but this is a mobile building and it's private. And then the member of the community will go into this health pod. And as I said, they have access to medicine and to primary healthcare services in these health pods. So the health pods are all managed by Black qualified nurses. So it's basically a win-win situation. So the community wins, but jobs are also created for Black nurses, Black qualified nurses, especially those that are entrepreneurial, hence the word nursepreneur.
So I've been a nurse for over 31 years. I've journeyed through state private, non-profit groups. I've been in the retail pharmacy for some time. And on my journey, I really saw the gaps there were between private and state healthcare. And I realized that there's a lot that we can offer as independent nurses, because not only do we bring our skills, we also bring our heart to what we do. And that is not always what the patient experiences in the private healthcare. So about 6 years ago, I read about the Unjani group on LinkedIn. I started linking with a couple of the sisters. And 4 years ago, I started my application process. And we struggled actually to get land in George. It's a very difficult area. But then the MTO group heard about it. They told Linda we could use the land here. Unfortunately, it is in the industrial area. So our patients, they really struggled to get to us. So we were very, very excited to hear there was a possibility that a very caring medical aid was going to fund us a pod to take the healthcare to the people that actually needed it. The area that we identified is called Thembaletu, and Thembaletu actually exists or is fragmented into 9 zones, but even on those 9 zones, there are other locations being added as we speak. And the area is so vast, it actually comprises of over 1/3 of the total population of George. And there's only 2 state clinics that's currently servicing over 40,000 people. So that was really not enough to give the people what they're supposed to get. So that is where we wanted to bring our healthcare as Unjani group. So 2 months ago, Bestmed came to our rescue and donated the mobile that you're currently seeing. And we've identified 4 spots where we will be rotating from, starting from Zone 1, Zone 5, Ramaphosa, and then also an area in Zone 8.
So in South Africa, there is a great need in so many areas. And often corporates, because they also have limited resources in terms of finances, in terms of people, can of course make a difference. And at Bestmed, we always believe that no contribution is too small. If you can make a difference, make it. But when you start taking hands like Bestmed did with Supersport Let's Play and even Unjani Clinics, the difference that you can make is so much bigger. So you can make a more sustainable, more longer-term difference if you just stand together and pool your resources.